Any advice given on Unity FM relating to health conditions must be verified by your doctor. General diet and physical and spiritual well-being is discussed on shows, but this is general only. If you have any medical condition or need medical advice, please consult a doctor.
Hello and Assalamu alaikum. This is Ali here with you with another great topic. I've got Mairead Ritchie from CLDF. Can you tell us exactly what that is?
CLDF, we are the Children's Liver Disease Foundation.
Right, and what does that mean?
We support families affected by childhood liver disease. We basically are the only organisation in the UK dedicated to fighting all childhood liver diseases.
Right, and how about yourself? What do you do?
I am the PR and communications manager for the charity, so I'm here to tell people like you and your listeners, raising awareness of who we are and what we do.
So are there different locations that people would get in touch with? Is it based in Birmingham?
We're a national charity, so
Okay.
we operate all over the UK, England, Wales, Scotland, Northern Ireland, but we're based in Birmingham, in the city centre.
So if somebody, how would somebody come about?
Very easy. If somebody has a child in their family who's diagnosed with a liver disease, the chances are they may not have heard of this before and they know very little about it. They can contact us either by telephone or simply if they search the internet and look for children's liver disease, they will find us.
Would they normally be referred by anybody, like a GP or
Normally, yeah. I mean, children's liver disease is rare. So normally, what would happen is because it's not an everyday occurrence. When a child is presenting with certain symptoms, they go to their local hospital for investigation. Mm-hmm. When it becomes clear that the problem is affecting the child's liver, they would normally be referred to there are 3 centres, 3 hospitals in the UK which specialise in children's liver disease, okay. And they are Leeds, King's College Hospital in London and Birmingham Children's Hospital here. Right. So the chances are that they would go to one of those centres, and we liaise closely with those hospitals. So we have our support team going out there, giving information to patients and their families, and we do a lot of work with the staff in those hospitals to make them aware of what we do and how we can help families. So generally, patients would be referred to us, but of course it's not compulsory, and there's nothing to stop anybody who thinks the child might have a liver disease or it's suspected to get in touch with us to get some more information.
Okay. So how does, we'll call it CLDF for short, of course.
Yeah.
How does that help children anyway?
The main way is that there are over 100 different liver diseases that can affect children from babies up to adolescents. They're all rare. And the main problem we find is that when a parent is told, or a young person told, we think this is a liver disease, they know nothing about it, they've never heard of it. As you can imagine, if you're told your child has a disease, you know it's serious, mm-hmm. but you've never heard of it. The main thing that people want straight away is information. What is this disease? Do we know what's caused it? What's the treatment going to be? What does it mean for my child? Where do we go from here? And we are able to instantly provide information on diseases that people probably know very little or nothing about. We provide that information in the form of literature to the health professionals and to the parents and to the families themselves. So step 1 is information, both about what their condition is and then what the next steps are. For example, what do all these tests involve? Are they going to stay in hospital for long? When they go to an appointment, what's it going to involve? We provide that's first and foremost. The other thing we provide is emotional support, because it's quite a shocking thing to be told that your child has a condition that can't just be cured like that. The main problem with all childhood liver diseases is that for most there isn't a cure. It means a lifetime of medical care, a lifetime of treatment.
That's right.
So that's a very difficult thing to suddenly take in. So we have staff who are visiting the wards, visiting the clinics. They're on the end of a phone. They can be emailed. So sometimes all people want is somebody to listen. And because our staff are dealing with this day to day, they know the main questions that people have, and they know what it's like to be in that situation. So it's emotional support, not just for the parents. With young babies, obviously this will be the parents, but it affects the whole family. So,
yes,
the grandparents will be upset. Siblings can be very affected, either because they might be a young child who's, a bit upset, very upset and jealous because mum or dad can't be there with them because they're in the hospital with a poorly baby, a lot of time with the child. Older children who understand more and can take in more will be very worried and concerned, and they might be very worried about what's going to happen to their brother or sister. So there are sort of shock waves going out, ripple effect through the whole family. And we always say we're not just there for the person that's affected, parents, grandparents, families. It affects the whole family, and we're there for everybody who wants to say, well, I'm worried, or what can I do to help, or what's going to happen next. So the emotional support is a really big part of what we do. And once we've got through the initial, okay, we're here to listen, we take that a stage further by running events, different sorts of events all around the country, which are designed to bring people together. So, for example, just before Christmas up in York, we held a special family day for families who might be based throughout the north of England that can get there to them. And we had a pantomime, we had lots of activities and crafts. It was great fun. It was completely outside a hospital setting. It was fun and it was silly, and it was all about getting children together, getting parents together, because it's really helpful when you feel that you could feel very alone. It's isolating because there are other conditions, I don't know, perhaps diabetes or arthritis, where its diagnosis is never nice. But if you know a bit about it, you might know what to expect. With liver disease, it's the great unknown. Most people don't know anybody else who's affected, so they don't know what to expect. And it's very comforting to then meet other families who say, well, we've been here and we're in this situation. You can support each other. And what's nice about these events is that parents who've got newly diagnosed children like meeting those who've been diagnosed some years ago. And you might have great big teenagers who can look perfectly well, and they've got their liver condition, but they've got on with their lives, and they're going to school and they're having outside interests. It's extremely comforting for a parent of a tiny baby who's just thinking that life's going to be all about hospital appointments, to look at somebody like that and think, well, perhaps there is some hope, perhaps there is a light at the end, the end of the tunnel, because the hospitals are absolutely amazing, and we all know that doctors deal in facts, and they'll tell you what to expect, and it's very easy just to think about everything in medical terms, and is life going to be a list of appointments and procedures and hospital stays. So to be able to meet people who are living with it and coping with it, and have good things going on in their lives as well, is a really helpful thing.
I mean, is there liver disease in children really a big problem or not?
Every week in the UK there are 20 children diagnosed. So this ranges from newborn babies up to adolescents. So that is, in the great scheme of things, that is a rare disease. That is classed as a rare disease.
It is.
But 20 a week is not insignificant. In fact, it's more. There's more cases of childhood liver disease than there are of childhood leukemia, and everybody knows about leukemia, and everybody's heard of it.
Yeah, there's more awareness.
Yeah, there is more awareness. I think it's largely because there are different types of liver disease. So yes, they're all affecting the liver, which is a vitally important organ. But because there are different types, you may not have heard of a particular condition, whereas you would have heard of one disease, be it cancer, leukemia.
I mean, as you mentioned earlier on about not knowing somebody, but then again, there's you did say 100 types of liver diseases. Could you give me an example of one?
Probably
that we might have heard of.
I can give you a couple. The most common of the rare diseases, if I put it like that, is a condition called biliary atresia.
Okay.
This affects newborn babies, and again, we don't know the exact causes of it, but something happens either before birth or around the time of birth, which means that the bile ducts which drain bile from the liver to the gallbladder either are not formed or they're damaged.
Okay.
That means that the liver cannot function properly and bile can't drain away. Now, fortunately, through research that's been done over the years, if that condition is detected early, then surgery can be performed which can help the bile to drain, and that liver may well work properly for a number of years. We've got children who've had that surgery, and it needs to be done when they're only a few weeks old, who are living healthy lives and have not yet needed a liver transplant. Sometimes the surgery doesn't work and they do need a transplant. Biliary atresia, there are about probably 50 cases a year, so it's still relatively rare. Another one is autoimmune liver disease, which tends to affect older children or adolescents. People have heard of autoimmune conditions, and autoimmune liver disease is one of those where, for some reason, the liver stops to function properly.
So basically, people may have heard of it in a different name, but it all comes down to liver disease.
It's all liver disease. So people have heard of hepatitis,
that's what
for example. Yeah, hepatitis. So autoimmune liver disease, we used to call it autoimmune hepatitis. So people know that hepatitis is something which affects the liver, and that is, one of the diseases. So yeah, when they affect children, we group them together because they're all rare diseases which affect children and young people. And the important thing with all of these sorts of diseases, as opposed to other liver diseases you may have heard of, is that they're generally, the causes are not known. Some of them are genetic. Many of the causes are not known at all. It's not to do with a child's lifestyle or that of their parents.
No.
So, whereas we know that some liver conditions can be prevented, for the vast majority of the children we support, they couldn't have been because the causes are not known.
Yeah, because before the show, I was talking to somebody about Children's Liver Disease Foundation, and they were like, "Oh, is that to do with hepatitis?" And because that's a lot of people only associate it.
Yeah.
But then there's so many, like you said, 100 different types of things.
Yeah. Well, there's hepatitis B, hepatitis C, autoimmune hepatitis. So yeah.
And everything affects in a different way.
Yeah.
Yeah. So of course, when it comes down to that, I think it's quite relevant.
Yeah. Yeah. It is, and the fact is, nobody chooses to be in this situation. And what we do is for the families that we support, we want to give those children the best chance of achieving their potential. And I mean, we're lucky that we're living here and now, and there have been amazing strides made in the care of children with liver disease over the past 30 odd years. So, for example, paediatric liver transplant is now possible, and is a fantastic treatment. A generation ago, that wasn't possible. These children didn't survive. So we've got a whole generation of children who they've been very poorly, they've had a liver transplant, they've grown up, they're having children of their own, they're living fulfilling lives, which is absolutely amazing. But the journey to that isn't always easy. Children with a liver condition might miss a lot of school. They have to go to regular medical appointments, have tests, biopsies. They will all be on daily medication. They might suffer side effects. Sometimes if they're taking steroids, it might make them gain weight, etc. So for many reasons, they might feel a bit isolated, a bit excluded. Some conditions, if the spleen is enlarged, children can't take part in contact sports. So that is not always fun. You know, if you're a young person who, you know, really loves their football or rugby or something, to be told, well, you know, this isn't the best.
So what
idea.
is like a typical medical care involved for liver disease? Of course, there's different sides of it.
Different side. Generally, it will involve some form of daily medication. Now, the amount and types varies from one case to another, but it will often be more than one. There could be a series of tablets, and that is not negotiable. They have to do that. Now, as you can imagine, it's one thing when children are very, very small and their parents are dealing with the medicine. But as they get older, teenagers don't always want to go everywhere armed with a list of pills that have to be taken, and to be told you can't do this and you can't do that and these tablets must be taken at a certain time. So that can be tough. Depending on how the child or young person is doing, there will be regular medical appointments. Now, this will depend on perhaps whether somebody has been transplanted or not. So they could be 3 monthly, 6 monthly, yearly. But they are very necessary to make sure that the liver is functioning as it should. So it's generally levels of medication and regular medical checks, and even if somebody's had a transplant, which is, you know, I can't overstate what a wonderful thing that is, but it doesn't mean that you just walk away and forget about it.
No, of course not.
If you've had any organ transplant, a liver transplant, you'll be taking immunosuppressant medication.
That's right.
For the rest of your life, and the person concerned needs to be.
Because a lot of people think once the transplant happens, that's it. You
Job
walk
done.
away, it's
Yeah.
done. And because whenever somebody suffers with any sort of illness and there's a possibility of transplant, could be kidney, liver, whichever, they're like, okay, what about the transplant? And they don't realise there's a lot more work to it.
Yeah, you're absolutely right. And it's
and it doesn't work for everybody, of course.
No. Sadly, there are cases where people have had a transplant and for various reasons they suffer rejection and they need to go back on the list and wait for
you being in this field, what would be like a typical medical care involved for a... I mean, we've just in fact spoken about that, but I wanted to go down more like actually living with that person.
Living with that person. So for a parent, let's imagine that it's a newborn baby. So it will be everything from the medication that needs to be given to them, which will vary child to child, but you know that could be quite a lot. Also their diet, because one of the problems, if the liver isn't functioning properly, then the nutrients aren't being absorbed and processed throughout the body. So diet's a real key feature. So it could be as part of their treatment they will see a dietitian and be advised, but in many cases a very high calorie diet is needed because those children will need more than normal to make sure they're getting what they need, because the body won't be absorbing it all. Once the child has been fortunate enough to get a transplant, then that shouldn't be necessary because the liver's working properly, so they go back to having a healthy diet. There are some rare diseases where the patient can't can't take in protein. So in that case, then they have to make sure that the diet is extremely low in protein. So diet is a big factor, and each child or young person will be advised on what's the right thing for them. Obviously, alcohol is not allowed because of the damage it can do to your liver. So that would be very restricted. Certain sports, as I said, certain activities could be restricted. That said, we have many young people and young adults who've gone on to hold down full-time jobs, marry, have families of their own, and what our young people always say to us is, yes, I've got this liver condition, and I haven't wanted to spend all this time in hospital, but I'm not going to let it define me. I'm going to go out and do things and achieve what I want to do, and that's the advice they always give to younger families in that situation.
Of course, we talked about the transplant side of it.
Yeah.
And even once you have the transplant, of course, there's so many medications you do. Besides that, is there any cure for these?
Sadly not. And that's one of the other things our charity does, is that we fund research into the causes and treatments of liver disease, because that's what we would really like if we could say, well, yes, this is a diagnosis and this is the cure. This is what can be done. Transplant is a wonderful treatment. It's great that we have many other medications which control the symptoms, but sadly there isn't a cure at the moment, and that's one of the things that we
and it's even more important why charities like you need to be there to kind of push that forward. And have that awareness where, I mean, when you hear about cancer, there's so many researches going on. When it comes to any sort of heart disease, there's so much research going on. When it comes to other organs, it seems like we're lacking behind. Even though times have moved on. But
no,
still.
absolutely, you are right. You're right. So little is known about it. And a cure is still some way off, and that, we would love to be able to say to all these families affected that they're not going to spend ages in hospital. It's not going to be a lifetime of medical treatment. That there is a cure.
Yeah, I think so. I think it's that's one of the reasons. How can you prevent liver disease? Of course, some people are born with it. Is there a way?
There are a few. The one liver disease which actually is the fastest growing and is preventable, which you may have heard of, is non-alcoholic fatty liver disease. When fat gathers around the liver, and that causes this specific disease. Not everybody who is overweight will get fatty liver disease, and indeed there are some people who have it who might not look particularly overweight, but generally speaking, obesity is a real factor in increasing the incidence of this disease. And you may well have seen reports in the press that obesity is becoming a problem across the board.
Yeah, I was just going to say that.
It is, and as obesity levels rise, so is the incidence of non-alcoholic fatty liver disease. And although patients with this disease at the moment only represent probably a tiny proportion of the families that we support, we are really keen that every action is taken to prevent this condition increasing, because our concern is there's limited funding. The NHS is stretched; it's doing an amazing job, but there's limited funding, and if we see a significant increase in children needing treatment for this condition, for non-alcoholic fatty liver disease, then there is less for all the other conditions which can't be prevented yet, that we are unable to prevent. So our view is that where any liver disease can be prevented, we need to do all we can to make sure that's the case. So to that extent, we are members of the Obesity Health Alliance, which is a collection of charities and organisations who fully back all actions that are taken, whether it's encouraging exercise, cutting down on sugar, cutting down on fatty food, because the best thing everyone can do is to maintain a healthy lifestyle. That is one liver disease that can be prevented, and prevention is very, very much better than cure.
I think I keep saying this on every show. Prevention is a lot better than treatment sometimes.
It is.
If you can prevent it to start with.
Yeah.
On that note, we're just going to take a short break.
Yeah.
And we'll be back in a few minutes. Hello and assalamu alaikum. Welcome back. We're here with Mairead Ritchie, talking about CLDF, which is Children's Liver Disease Foundation. Moving forward, we were talking about non-alcoholic liver disease.
Yeah.
So just to kind of like finish off on that. So basically, of course, we're talking about kids here. And as the name says, non-alcoholic, meaning it's nothing to do with
alcohol. People, I think the first thing people think when you mention liver disease is alcohol abuse, and of course, alcohol abuse does lead, can lead to liver disease, and it is a factor in our adults. Non-alcoholic fatty liver disease, NAFLD, we call it for short, is on the rise, and as the name says, nothing to do with alcohol, but obesity can trigger a liver condition which is very damaging. So yes, it affects children, it affects adults as well, and it can be prevented. So anything we can do, we should.
Somebody who's suffering with liver disease, are there any diet concerns? Obviously, depending on the treatments, I guess.
Yeah, it depends on the. Some of the genetic diseases, there'll be a very specific diet, and their dietitian will guide them on that. As I've mentioned, children will often need a very high calorie diet if the liver isn't functioning properly. In the majority of cases, though, they will be advised to eat as healthy a diet as possible in terms of the right proportions of protein and carbohydrate, whole grains, fruit, vegetable, plenty of water, and cutting out fizzy drinks and excess sugar. That would be my main concern.
With children, of course, are there any signs to look out for to kind of detect it early?
Yes, the main sign in newborn babies, and probably I'd say of the cases of liver disease that we're talking about 40% of them occur in newborn babies, and the main sign is prolonged jaundice. Now, jaundice is something which affects the majority of newborn babies. So, jaundice in itself isn't a particular warning sign, and I certainly wouldn't want to panic anybody and say, if your baby is jaundiced, it must be liver disease. But if that jaundice persists for more than 2 weeks, I would say to any parent, more than 2 weeks, take the baby to your doctor or ask your midwife or health visitor or whoever's coming to see you that you want a blood test. The blood test is known as a split bilirubin blood test, but you don't necessarily need to remember that. That is the name of the test.
But they would
and
know
that,
that
that would test to see if that jaundice is caused by a liver disease. And I know that jaundice isn't always that obvious, particularly in Asian-skinned or brown-skinned babies.
No,
but look at their eyes, look at the whites of their eyes, and if the whites of their eyes are yellow. We have had many cases where the child's skin looks quite lovely, really. It doesn't, they don't look poorly, but you look at their eyes.
Because normally with a newborn baby, their eyes are amazing, isn't it?
Yeah.
Like pearly white.
Absolutely. And
then obviously if something's not quite right, you'll notice it more.
Look at the whites of their eyes. And I've had mums say to me, do you know what? They only seem slightly jaundiced. It wasn't even that bad. When it goes on for more than 2 weeks,
of course,
go to the doctor. The other sign, not a very pleasant thing to talk about, but baby's nappies, baby's poo. If that is pale, chalky, that again is a sign, and straight to the doctor or ask your midwife or health visitor, get it checked. Because if liver disease can be detected early, before the age of 8 weeks, it's possible for the child to undergo surgery, which would prevent, certainly in the meantime, would prevent them having a liver transplant.
And I normally always say, anyway, if you have any doubts, just ask the question.
Do ask the question, and don't think, oh, I'm being a bit fussy. Sometimes with a new mum, if it's your first baby, you don't necessarily know what's right and what's normal. So if you've got any concerns, just say that you want it checked. But that's the golden rule: 2 weeks of prolonged jaundice. Ask for that test.
So are there any other medical conditions that could be caused by or related to liver disease?
There are a few other conditions which could present with the same symptoms that jaundice could be related to. But again, if you ask for that test, that would rule it in or rule it out.
But normally, like the specialists, if they do discover the child has liver disease, they would normally check out for other things anyway.
Yeah, that there would be. I mean, liver disease is obviously a serious one, so they would rule out other things. But they would be looking. This particular test would identify it straight away.
So, any side effects from the treatments that they receive?
Sometimes our children talk about feeling tired.
You get that with
feeling tired. Yeah. They talk about feeling tired, which might often mean, particularly when they're younger, they don't always do a full day at school. They miss a little bit. Sometimes, if a child is on steroids, it might cause them to gain a bit of weight, which again is quite a known side effects of steroids. But I think most of our children or young people, if they were listening to this, would say, no, I get on with my life and I don't let it stop me. No, it doesn't affect. I think tiredness is the main one that I am.
And I think as we were talking about having awareness, I think as time's gone by, for example, hepatitis was quite a common one. Even the treatment for that has improved so much, where in the olden days it used to be, I mean, I'm saying olden days, it was only like 10 years ago where they used to have the injection form. A lot of it's moved on to tablet form. And the tiredness is not even that bad anymore. No,
and one of the brilliant things is something that we've campaigned for over the years, is we now have a vaccination for hepatitis B, which means that can now be given to newborn babies to prevent them getting it, which is an absolutely fantastic step.
Yeah, absolutely.
For Hep B. So that is one that we hopefully will not be seeing in the future.
The other thing is, how we were talking about children going through different stages in their life, and the importance of following your medication and treatment.
Yeah,
that can be quite difficult for the family, and
it can be difficult, and it's ironically it's probably more difficult if a child is feeling well, if they've had their early surgery, or maybe even if they've had a transplant and they're feeling good and they're going to school and getting on with things. It's very easy to think, well, do I really need this? I look the same as everybody else. I feel the same as everybody else. Why have I got to take all these tablets every day?
It's like the saying, what you don't see doesn't hurt.
Exactly. But it is vital that they do. And that is one area that we can help, because one of the things we do is that we put children and young people in touch with each other, so that they form really valuable peer support networks. Most young people who are diagnosed with a liver disease won't know anybody else in that situation. So we bring them together. We run a number of residential events where these teenagers can go off together. They might go off on an outward bound adventure course doing stuff that they haven't done before, because sometimes it's not easy to go on a school trip. You know what it's like? You go on a school trip, you've got to fill in loads of forms and disclaimers, and it might not be that easy to take all the various medication. Then what if somebody has an injury, or there's a concern about them falling or getting them home? So school trips are not always easy for every child in this situation.
No, of course not.
We take them away because we take them away with our staff, so they can go and do all this outward bound high ropes around the campfire, and they know all about it. But most importantly, they are with other young people like them, so they haven't got to explain, well, I can't really do this, and this is tricky because I've got a liver disease, because so has everyone else. And they always report back to us that they find that really comforting, to not have to explain all of that, and to be with people who understand what it's like and to know what it's like. And to come back to your question about the medication, that when they are hearing from another young person, well, do you know what, I thought I didn't need my meds and I didn't take them, and I became poorly and I ended up in hospital, it makes much more sense to hear that from somebody who has been there and got a reason than your mum nagging you, because that's what mums do, to take your medication. So it is one area that we do find it helpful to have these peer support networks, so they can contact each other and talk to each other, and there are things that only they will know about.
It's like anything, I think, if the medication, it is important. I think it has to be done. There's no ifs and buts about it. But it's the understanding of it. Yeah. The importance of it.
Yeah.
I think if you're in that environment and you see other people who've been in a similar situation, just makes it that little bit easier.
Yeah, and you're going to be much more accepting hearing from somebody who understands you, because they have a liver condition and they have to do it. And I think it can be very easy to feel, when you've got a rare condition like that other people don't really know what it's like. We have young people saying, I've got some really close friends, some really good school friends, but they don't know, because they don't have to do all this. They they don't know. So to be in a room where everybody in that room, they might not have exactly the same liver disease as you, but they've got to go to all the clinics and have the appointments. So it helps a lot.
And then they don't have to kind of like answer their own question of why me, because then they see everybody else as well.
You're right.
Kind of like in a similar boat as well.
You're right. And if you're talking to somebody who maybe has this rare condition, but they're still going out doing sport, doing their cycling, or they've got a place at university, or they've got a job they really enjoy, it makes you think, well, maybe I can do that. I don't have to let this stop me. And we're really delighted now that we do have this generation of young people who wouldn't have been here 40 years ago. It's fantastic that they're here and doing their own thing, and we want them to keep encouraging.
Yeah, because I think the age we're living, it's so easy to pass messages on. Yeah. And it's important to pass the good message on.
Absolutely.
And the more we do that, the better it'll be for the future even more. So another 40 years down the line, maybe this wouldn't be such a big concern.
This is what we hope.
Yeah. I mean, it's like the more research goes into it, the more helpful it's going to be for everybody.
Yeah.
So, who can get help and support? I know you kind of like mentioned this in the beginning.
Anybody.
Kind of like go back onto
anybody affected. So, if you suspect or know that somebody in your family has a childhood liver disease, please do get in touch with us, because we want to help you.
Yeah.
And that could be, you know, in the form of sending you some leaflets. We can give you information to send your child's school to help them at school. But anybody, parents, family, friends, or if you're a young person yourself, that support's available to you all. Just call us or find us online, Children's Liver Disease Foundation, and we'll be there for you wherever you live throughout Birmingham or in the country.
Is there a number they can contact as well?
Yes, you can call us on 0121 212 3839.
Okay, or visit the website.
Or visit the website.
Okay. So how can our listeners support or provide any sort of help to?
I would say two things really. The first is, please do get involved with fundraising. Our main fundraising event is Big Yellow Friday, and again, if you just search Big Yellow Friday, you'd find it. All we ask people to do is do something yellow. Maybe wear yellow that day. You might have a yellow cake sale, or simply donate online. It's that easy. We do not receive NHS funding. We don't receive statutory funding. We rely on donations, on charitable donations. So every penny that is raised makes a real difference to a child with liver disease, and we don't mind. We've had everything from people organising a whole fun day or a special ball or evening event, to somebody having a coffee morning or a cake sale, or just getting in touch and donating through the website. However you want to do it is great by us, but please join in with Big Yellow Friday. It's a lot of fun. And
so basically, even
too.
like companies like the workers,
Yeah.
employees, they could do that, similar to some of the other charities.
It is very similar, very easy, and we have everything from people coming to work dressed as a banana to people just putting a yellow tie on, or bringing in some cakes, or just putting money in a tin.
Yeah,
Simply,
definitely.
and we will help you. We've got a great fundraising team, and if anyone's thinking, well, I'd like to do something but I don't know what, they've got loads of ideas. We'll give you loads of help, and we're really grateful. We're really proud to be, although we're national, we're based in Birmingham, so we love to get as much support as we can from the local community.
Absolutely, and I think our listeners normally do as much as they can.
That would be brilliant.
So I'm quite confident in that.
Yeah, we'd love to hear from you.
Yeah. So the other things that people that be
one really simple thing but hugely helpful thing to do would be to join the organ donor register, which you can do online. It takes 2 minutes to do. There is a shortage of livers. There's a shortage of all organ. And every day, 3 people who are on the waiting list for an organ die waiting for a transplant. And by joining the organ donor register and agreeing to donate, you can save up to 9 lives. It's amazing. And as well as joining the register, the other really important thing you should do is tell your family. Tell your family about your wishes, because if anybody is in that situation, it's the family that will have the final say-so and give consent. So you're talking about a very emotional, one of the worst
Absolutely.
situations possible for a family to be asked, can we donate your loved one's organs to save a life? If they know that person wanted to do that, it makes a really, really difficult situation a little bit easier.
Yeah. Absolutely.
So we always ask everybody, join the register. There's a real shortage of
And I'm sure
donors.
a lot of our listeners, well, at least some of them that have a family member or a friend who's on that sort of waiting
Very
list.
likely, yeah.
And,
and it's
kind
tough.
of like it has to come from somewhere.
Yes.
And that's exactly what you're waiting for.
Yeah,
basically.
and be assured that joining the organ donor register is simply, it's an indication of your wishes. Everything is handled in the most incredibly sensitive way by highly trained specialist nurses and doctors who do everything in conjunction, close conjunction with the families. But speaking to our families who've been on the receiving end of an organ donation, I've just said that it is the most amazing gift that anybody can give. You have literally given someone a life. We all like to give where we can and help people, but this is the ultimate gift.
And even if anybody has any religious concerns, they are quite sensitive about it. And
incredibly, in fact, now when you join the organ donor register, they will ask if you follow a faith or religion, and if you want that to be observed as a part of being on. And I know that the people at NHSBT, the NHS part that deals with that, have worked very closely with all religions to ensure that wishes are covered and people's views are followed and respected, and we've had some wonderful help from imams and leaders of various faiths who've come on board and said we want to do what we can to
of course. And of
increase.
course, if you have any concerns, do speak to your
please do
Maulanas and imams.
Yes, yeah, please do.
I think a lot of the issues that our listeners have, because they need to get more information, but again it comes down, the final say is the families, of course.
Absolutely.
So it's not like if this is your wish, but still if the family feels against it for any reason, then it is their say.
It is their say, and that is why it is so important to talk to your family, because if you felt strongly about it and you wanted to give and you join the organ donor register, if your family were unaware and felt differently, they could still say no. So the most important thing is that your family know and understand your wishes.
Is there anything else that you'd like to add for our listeners?
No, other than to reiterate that we are there for everybody, and if anybody feels that there might be a child is showing symptoms of liver disease, or their child is affected and they would like our support, please get in touch, and if not, then please do contact us and do whatever you can to support us. We're a Birmingham charity, and we would love to have you involved.
Yeah, like they say, whatever you can do, even if it's just spending a day with one of these fundraisers, everything, of course.
It really does. We have children sending money in they've got from paper rounds, or they've had a little cake sale in school. With a charity like ours, we're not one of the huge charities.
No.
We're small, and every penny counts. So don't think, well, my donation wouldn't really make a difference.
No, it does help.
It really would.
Yeah. No matter how small or big
Absolutely,
it is.
no matter how small, and you can do it so easily through our website.
Yeah. Can you just remind us with the website and the phone number again?
Yeah, the website is www.childliverdisease.org, and the phone number 0121 212 3839.
Thanks again, Mairead, for coming in.
Thank you for having me.
Really, we've learned quite a bit about it, but of course we need to do a lot more. Again, just to remind our listeners, anything that you hear relating to health topics, do refer to your GP or your specialist before taking any advice. Thank you.